Hi, hope you're all well. I'm Viv, or this week it may be Vivi Potter, and I'll explain that later. But it's a good Thursday today, a day when Boris Johnson has finally resigned from government, and it's also the first of a series of lives that myself and Dr. Sunny are doing with practitioners around the world. And this week I'm going to hopefully speak to a lovely radiologist called Dr. Carolina Mariluis, and I can just see her there. Hi Sunny, hope you're keeping well. I will remember to add you later on, don't worry. Myself and Sunny haven't broken up, we haven't I've been fighting, we're still doing lives, but we thought we'll do today's with myself to begin with, and Sunny will join us later. So I will add Carolina, and she'll hopefully... this is the first of a series of 4 lives with different specialists around the world who specialise in aesthetics and ultrasound. So let's see. Hi Carolina.
Hi Viv, how are you?
I'm fine. How are you doing? It's nice to finally do a live with you.
Hi. Excuse me, I will take off my headphones.
Okay.
Here.
Hear me okay?
Better.
Good, good. You're looking well. Ah, there's Rachel from Bell Health. I'm just going to say hi to all these people. Sunny will be joining us after we've had a little chat, the two of us, and he'll go through a little chat with the two of us about what we're speaking about now. Well, we've got all sorts of people joining us now from all over the world. I think yes. I'll introduce you, Carolina. We met last year online, and because you did a really nice thing, you recorded a Christmas video for me, and
yes.
It was really kind of you. Your background is radiologist. You're a doctor, but you're also a radiologist.
Yes. I am. My subspecialty is musculoskeletal and, of course, facial radiology too.
Yes.
Here in Argentina.
You, as a radiologist, are an expert in the work that we do in aesthetic practice using ultrasound in particular. So I thought it'd be nice to have you as the first guest of a series of lives where myself and Sunny talk to you and a few other practitioners about using ultrasound in aesthetics. So thanks a lot for joining me this evening, Carolina.
No, thank you. Actually, it's an honor for me. Thank you.
Oh, it's really kind of you. You're speaking all the way from Argentina, in Buenos Aires, is it? Ooh, just breaking. No problem. You're good. You're based in, is it Argentina? You're based in Argentina?
Yes, in Buenos Aires.
Buenos Aires. Excellent.
Yes.
So, with your background, you specialise in musculoskeletal and facial radiology, using ultrasound in particular. You're also the associate editor of the Radiological Journal of Radiology, is that right?
Yes, the Journal of Radiology. Yes, I love research. I love studying every time, and yes, it's great. I read a lot, study every time.
Whenever we've spoken online, you're always busy checking lots and lots of MRI scans. Yes, hundreds of MRI scans, and you're trying to speak to me in between checking all this work. And you're a busy mother. You've got 2 children as well, and you're really busy in your work.
Here in Argentina, I used to say I'm Mama Luchona. It's like a mom full-time with 2 kids, small kids.
Yeah.
And in the same time, I read a lot of MRIs. I love radiology, and now I'm researching in facial radiology, MRI, CT, and ultrasound, of course.
Ultrasound, which is why we've got you here tonight. So,
with my lung, like you.
Yeah. So you use a Clarius L20 HD ultrasound scanner just like I do. Now, the reason, I'll better explain, the reason I'm wearing these glasses is because you thought it'd be a great idea to wear glasses looking like Harry Potter.
Yes,
I've got all these people I've got all these people viewing us and I can't even read all the messages. We'll let Sunny deal with that later anyway. But the scanner, the ultrasound scanner, this is one of the few different ones that can be used in aesthetic work. And I thought we'll do a little bit of a chat about the work that you do. And also we'll look at maybe one or two scans that I've worked on for you using computer graphic enhancement to show the ultrasound images more clearly. So I'll do that with you in a little bit. The reason I'm dressed up, as I say, with the glasses, looking like Harry Potter, is because I did a little promo picture with you, me, and Sunny dressed up as characters from Harry Potter. And I thought it'd be nice to display a little bit of magic to show people what we can do using this fantastic technology in the work we do as aesthetic practitioners. So, the types of work you do, Carolina, musculoskeletal is one area. With facial work, how do you use the ultrasound? What do you do with the ultrasound in terms of facial work? How would you describe that?
Yes, I think the facial radiology will be in the future, or now, even now, a new subspecialty, because we need to research. And every time I used to see, first of all, normal structures beside our skin. We have glands, we have vessels, we have muscles, and the reach and the benefits of ultrasound is that we can evaluate them or watch them moving. The last week I saw a patient with a nodule in her lip, and when you studied it with ultrasound in an static way, you couldn't find it. But when patient move her lip, I could see it without any problem. So it is the benefit of ultrasound over maybe another method. In terms of ultrasound and use in, say, Argentina, do you think it's used a lot, particularly portable ultrasound like the Clarius scanners? No. It's really new here. I try to show it here because it's so important. Every time I see patients that don't know what they have under the skin, maybe they don't remember which kind of filler they had, but or sometimes they were even told what kind of filler it was. It's so important because most of them are non-biodegradable, so it's a potential risk of adverse events, I think. So it's really important to take care and go to the doctor and make scans, ultrasound scan if you don't know what do you have. With the older fillers, the non-high hyaluronic acid fillers, the ones that we used maybe 10, 20 years ago, those fillers are still in patients that you see now. And it must be difficult. It must be very difficult for you to try and figure out what's wrong with somebody's face based on treatments that you have no idea about. Yes. You have to scan. You have to scan and try to find out what is going on. What is the reason of that inflammation, of that nodule? It's really important. It's great work that you do. You've been presenting at conferences. I think you presented at the Mesoaesthetic conference a few months ago. Is that right? Yes, because they had great fillers. Mesofillers that of HA, and they are really new here in Argentina, and it was its presentation, so I could show something about HA in different places, in different regions of our face, so it was really great. You must be one of the top experts
in the use of ultrasound in South America and certainly in Argentina, there can't be many practitioners, many radiologists that deal with aesthetic issues like you. Is there many other people?
It's a little strange for me, actually, because we are not too much radiologists doing this. But if you see in Brazil, you will talk to Rosa next week, maybe, or in a few weeks. And or Chile, you have a lot of professionals, but not so many radiologists. So it's great because we have a lot of information from our studies and our subspecialty that is really important. And we could research more and read more and look it with more attention.
It's great work you do because you do a lot of educational work, and you are teaching also. I think you teach work.
I say that I'm like tronchatoro, you know, with my kids. No, of course, I love teach. I try to make it easier or just talking, because I know that ultrasound is a little difficult at the beginning because you see a lot of grays, a little more dark or brighter, but I say black and white, and you see here, let's make a draw, or try to make it easier, because you have to understand that you can see your anatomy. You have to remember that when you push it here, what do you have under here? I have the masseter muscle and the parotid, and you have to remember the anatomy and try to figure out.
You've been great, because when I started using ultrasound myself, using the Clarius scanner, I contacted you in January, I think, and you were really nice to me to help me understand how to use the technology properly. Like when I first used the scanner, I was pressing so hard. I kept thinking you need a little bit of gel and lots of pressure. Exactly the wrong thing. Lots of gel.
You were trying to find the facial vein, I think. And you were putting a lot.
But you were really good because you were patient with me. You listened to what I wanted to do, and you helped me use the scanner much better than anyone else could provide any information to me about. You know, you were the expert, and you are the expert in anatomy and diagnosing problems using the likes of ultrasound. I've just got to say hi to Leonie. She's watching us, Carolina. She's joined us. So we'll say hi to you, Leonie.
You have your teacher, your big teacher.
Leonie loves watching the lives, and she admires your work as well. And she's going to be on the live next week. I think next week she's joining me as well. Right. But this week, I thought it'd be interesting. Would you say you'd have any tips for practitioners who are thinking about ultrasound, who might be using ultrasound? What few small tips would you have for them, Carolina? It's just reconnecting. It won't take a second, hopefully. Hopefully she's going to join me back again. Hey there, Carolina. See where she's got to. Oh, I seem to have... oh, you're back.
I'm back.
You're back. I thought you'd left me there, but it was just the tips. What tips would you have, Carolina, if a practitioner was considering using ultrasound or maybe starting using it?
First of all, if you want to start, you have to find a high frequency scanner, not just Clarius. You have a lot, Philips. There are a lot of scanners, but you have to be careful in this point, because maybe you won't see anything in your face. It has 15 megahertz at least. Yes.
Right.
And then, of course, you need a big quantity of shell because you have to create like a pillow between your scanner and your skin. Yes, you will have a great image doing that, and you won't push too much.
Yes.
And then you have to be really soft. You have to move really slowly. So, because you have to remember that we have really small structures in our face, so you could miss them in a second.
Now, with the face, we're not dealing with really large depths of tissue. It's only a few centimeters. So the frequency...
Wait a minute. Come here. My kid is crazy for... Say hello. Hello.
Hello.
Hello. Hello. Nice to see you.
She's April.
April.
Bye. Come on, April. Go back.
Nice to see you, April.
This is one of my distractions.
Yeah. You've got nice distractions. She's a nice distraction to have. She's a nice distraction. But you were saying
my real life.
What was that, Carolina?
My real life, every day.
Every day is real life. But with the scanning, as you say, you've got to be careful. You need lots of gel. The frequency range is important because with the tissue in the face, we're only dealing with a couple of centimeters of depth. It's not like the abdomen. So the frequency range is important. 15 plus, that's the range you're looking at. Anything lower than that isn't going to give good definition in that area, is it?
You will see everything too much gray. Almost the same. All the tissues you are watching, they will be more difficult to find out. Different structures and different colors or scale of gray.
What about things like training? You know, in the UK, there is training available to practitioners who are thinking about using ultrasound, and those who started using ultrasound as well. There's the groups like Cutaneous, Leonie's group in Amsterdam, who travel around the world as well. Do you provide training in Argentina as well? Do you train practitioners to use ultrasound?
Yes. I love teaching. So I had to do it.
It's a difficult. When I started in January,
I'm not cutaneous. I'd like to. I'd love to know you, all of you, Leonie and Peter. But here in Argentina, we are trying to make us bigger.
But you do great work. You're the expert in this area. As a radiologist, you know more than anybody else. I speak to you because you've got so much knowledge about this area. I wouldn't go to someone who hasn't got your knowledge. What do you think practitioners, do you think it's difficult for practitioners at the very early stage learning how to use the ultrasound? For me, it was a very steep learning curve, very difficult at the beginning, but with more and more practice, it becomes easier. What do you think about that? Do you think it's difficult right at the beginning?
First off, you have to think that what you know about anatomy, you can find it with your scanner. So you have to figure out that you have to find different scales of gray. And to be patient, you have to practice. Your first day would be difficult, but then you have to practice. And I see it in you. You improved a lot. When we made this augmentation, the master muscle, you made it alone, almost alone. So you are becoming an expert too.
I'm a long way from your expertise, Carolina. I don't think I'll ever become as expert as you.
I tell you that I sent you the images and the video, and you made it alone. So
Well,
It's just you have to practice. If you practice, you will improve your knowledge.
Yeah, yeah, I agree completely. Now, as you were saying, we can use the ultrasound to look at anatomy, and what you mentioned there, masseter anatomy. You did a scan using your ultrasound scanner at your clinic, and you sent it to me, and you very nicely let me play with it using my CGI graphics software. So what I thought was, as Harry Potter, or as Vivi Potter, as you can call me, I'll use my my scanner, and I'll cast a spell. You know, the Lumos spell, and this is dedicated to Belle, who's a little girl, who's the name behind Bell Health in the UK, who are the Clarius distributor. So she said, Viv, why don't you create a Lumos spell to use your scanner? So we'll use the Lumos spell and we'll produce light from darkness. So I've worked on your scan of masseter movement, Carolina, and I'll show it here. So this is a scan of masseter muscle movement. At the top we have skin, lower down we have bone, and in between there's various tissue. It looks of shades of grey. It's difficult for a new person to understand what they're looking at. You can understand it, and I can understand it more easily now, but it shows movement of masseter muscle. So what I will do, I will get the augmented version of it. Now this is the version I augmented. Oh, let me see. Sorry, it's the wrong one.
Almost there.
There it is. So that's the augmented version. And basically it shows, I haven't reversed the image unfortunately, it shows the tissue movement around the masseter, two groups of masseter muscles, and there's a ligament between the two of them which separates them. And what the ultrasound helps us to do is look at the anatomy more carefully. I'll switch to this is a comparison of the original and the augmented version, so you can see the difference. Now, you carried out this scan because, thanks very much, Leonie. Leonie loves this scan that you've done, Carolina. She thinks it's great. So I just augmented it a little bit just to show the tissue more easily. But one of the benefits of using an ultrasound scanner is to look at natural anatomy. And because it varies so much between one individual and another, it helps us identify problems. It helps us carry out treatments a lot more effectively.
Yes, and as you said, differences. All patients, all of us are different. We have different tendons too. In this case, this masseter muscle have a deep tendon that is different with different patients, and it is related to adverse events of that, because you could have a bulging masseter if you don't try it properly, because the tendon acts like a barrier. So your augmentation make it easier to understand how it moves. You can see easily the movement of the muscle and the tendon between both bellies, the superficial layers of this muscle. And it's easier to understand when you work with your magic, as I say. And it's important ultrasound and understand ultrasound to reduce risk. And because for example, talking about toxin, if you want to inject this masseter muscle, you have to take care because you have to inject the deep and the superficial part of the superficial belly of this muscle to reduce side effects. And you have to pay attention, because if you use your scanner, you will see that your parotid gland is really close to that muscle. And then you have the resortius over here, very superficial. So you have to pay attention here.
Excellent. It's just that the toxin treatment in the masseter muscles can be used to reduce a wide set jaw to make it more slimmer. So that's the treatment we were talking about. I will add Sunny, because otherwise I'm going to forget, Carolina. Let me add Sunny. I'll just get him up. I won't be a second. I'll just try and find him. So this This is one of your first lives, isn't it, Carolina? I've just sent Sunny this invite. There we go. I'll hopefully get Sunny joining us, but 1 second, he won't be too long. But the work that you do, you enjoy it. You enjoy the radiology work that you do with patients.
I love what I do, actually.
Yeah.
I think that I will do it and again and again. I am a radiologist. I have it in my veins.
This is Sunny, Carolina. This is Sunny, who we haven't split up, we haven't broken up our lives. We basically thought it would be easier for me to speak to you first, and Sunny can comment afterwards. So, what did you think, Sunny?
Yeah, no, it's brilliant. I was actually going to just message because I didn't want to interrupt Carolina's flow because I was enthralled, Carolina. So you were just literally describing beautifully the masseter, the difficulty injection, and obviously the surrounding anatomy. So it was really, really well done. You guys were on a roll. I really didn't want to interrupt because it was getting really interesting. But I did have a few questions, Carolina, for you. And I think more to understand your scope of practice. I think maybe any practitioners who are watching in the UK. Well, firstly, like obviously you do aesthetics as well, in addition to all the other work you do in radiology. So what's your scope of practice, and what sort of treatments do you do in your private practice?
I think with Carolina, I think it was more because of her radiology work. You tend to assess problems that other people have carried out. Isn't that right, Carolina?
Excuse me. Yes. We have to carry out, with ultrasound, or maybe I lost the last part you said.
I was just going to say, do you do any, in addition to the radiology, do you do any treatments, do you do any aesthetic treatments as well in your clinic, or is that?
Yes, toxin. I'm not so familiar with HA injections because I read too much complications and I do a lot of research about it. So I think that I will stay in my radiologist part, maybe. Toxin, yes. Another kind of treatment, yes. But fillers, I think that this today, I don't know if I want to inject them.
Okay.
Yeah.
That was because I looked at your Instagram. And obviously, I know that you do toxin, but I was just interested because you do some mesotherapy as well, don't you? But hey, that's fine.
Yeah.
Obviously, I realise obviously you help to assess obviously problems.
Yes.
In this country, we find that sometimes patients, we call it shopping. They'll go from one practitioner to another, not knowing what they've had done. Do you find the same problem in Argentina as well?
Yes, more. I think that more than you, because here we have a lot of people. I told Viv recently that sometimes come a patient to my office and they have a nodule and they went to their doctors and they didn't respond its call, their calls, for example. So yes, it happened here too. It's terrible because patients don't know what to do or where to go, and you have a lot of professionals here and you don't know who is able to resolve your problem, maybe, or who could tell you what is going on there. So with our scanner, we can do it now.
Brilliant. One of the things that I noticed from the scanning is that, are you able to now, because of your expertise, are you able to differentiate between different types of filler, or because you were mentioning so can just tell us a little bit more, like how did you learn to do that then? How did you learn to differentiate?
Well, first of all, you have a lot of articles about it, of course lessons too. I visit to Brazil this year with Esteban is a great radiologist there. And I had the pleasure of assist to a conference and a course of him. But you see, silicone is really popular here, and you can find it easily because it's make like a shadow, a snow storm that don't let you to see anything. So it's really easily to find out. I read MRIs too, and MRIs, it's really, really important in this point because you have a great field of view, and you have specific technique to view to find silicon. They are called silicon only, for example.
Okay.
So it's really easy.
That's amazing. My last question was though, what's the most difficult case that you've dealt with in your expertise in terms of diagnosing or managing or assessing? What's the most difficult case that you've come across?
I saw here in the theater a nodule that was making bigger and bigger, and when she came, I scanned her, and she had like a granuloma or granuloma-like, because you know that we don't say granuloma in radiology because it's histological term.
Okay.
But it was like a granuloma with a lot of flow inside, but with hyalinox.
Yes.
It's right? Yes. It's just disappear in a few sessions. So it was an active, and that was the reason that made it bigger and bigger in time. Wow. Because of its flow.
Wow, that's amazing. Amazing, Caroline. I'm sure that we would love to do more radiology-focused talks with you. But Viv, I'll hand over to you, seeing as you're hosting. But that was amazing.
Thanks, Sunny. It was really nice, Caroline. I've loved speaking with you over the last 6 odd months, you know, with all the help you've given me. So I've got to really thank you for joining us in our first live with a colleague from around the world. So I've got to thank you a lot for that. In terms of the future, what would you say is the future for aesthetic practitioners? Do you think practitioners should look at the possibility of using ultrasound, at least think about it?
I think that here in Argentina, in the future, we will be like you, maybe there in London and the US, and for example in the US or Brazil, more dermatologists and injectors will have scanners in their office, I think, because it is the future. It's here. Maybe radiologists are a little jealous because of it's our work, but actually. Ultrasound is here to help. We are talking about people, about patients, so we have to be careful. And if we can include ultrasound scanners in our practice, it's better, more better. Yeah, we have to study just and practice a lot.
We love watching your lives and all of your posts on Instagram, because you do a lot of educational content for practitioners and for patients. So I hope you continue, and I hope you build up your posts and all the work you do with training and training other practitioners as well. It's really good of you. Hopefully in the future we'll do more lives together. But next week we've got Leonie Schelke from Cutaneous, who'll be joining us. Right. And I hope you watch that as well, Caroline. I hope you watch that live next week. But I just wanted to say thanks a lot from me and from Sunny. I think he enjoyed it as well. And we will let you get on with your evening in Argentina, and we'll be back next Thursday at 8:30, and we'll be speaking to Leonie Schelke. So thanks a lot for all of your help, and thanks for joining us this evening, Carolina.
Yes, okay. Thank you for this invitation.
Okay, it's an honor. Thanks a lot, Sunny.
Thanks, Viv. Bye-bye.
Okay, see you both. Bye.